Good evening. Welcome to NTV People's Parliament. My name is Betty Mudondo, and I'm the Speaker of the People's Parliament here on NTV, and we're coming to you live from Mubende District. We're coming to you from Mubende Municipal Council Hall, and we are here in the district to assess the state of health service delivery in Mubende District. With me in the August House, I have different members of Parliament who are here to represent the different sectors and the different departments in the health sector, and we're going to delve deep to understand. We are in Mubende looking at health, what is working, what is not working, what is actually here in Mubende District that the residents need to know, what services are accessed in Mubende that the residents need to understand. But sometimes they don't know what exactly is going on in their communities, and they seek medical services out of Mubende District. Mubende Regional Referral Hospital is in the center of Mubende District, and it serves millions of patients, and these come across the different districts in the greater Mubende region, and we are looking at Mityana, we are looking at Chegegwa, we are looking at Jankwanzi, and some coming through from Chiboga and as far as Gomba. So today we are here to understand, why do people have to trek long journeys, sometimes from their constituencies, from their sub-counties, from their parishes? What is the state of Health Center 2s, Health Center 3s, Health Center 4s, and how can we move forward? What can we do to improve the state of health service delivery in Mubende District? Welcome so much, honorable members. I'm glad to have you in the August House today in big numbers. And to kick off this conversation, we shall have a preamble. And here with me, I'm going to call onto our first speaker. We at the Municipal Council, and the Speaker, I took over this chair this evening, but please take the honors to invite me officially before the other honorable members.
Honorable Speaker, allow me first of all to thank you for giving us this opportunity to host the People's Parliament in the Mubende Municipality and the Mubende District at large. Members, allow me to welcome you to this August House. You are most welcome. Feel at heaven. Members, I'm glad to open up this session. I received a congregation from NTV, and I'm very happy for the way how they work. Madam Speaker, things were not easy, but they are very disciplined people, Madam Speaker.
A round of applause for that.
Yes, they are very disciplined people, and the way how they handle issues. I like their way how they handle issues. Madam Speaker, back to the topic. Here in Mubende Municipality and Mubende District at large, we are so obliged that we have hospitals. Government constructed a referral hospital, is here with us. Government gave us the health centers 3, here at Rwemikomago, and the health center 2 at Rwabagabo. The structures are well constructed and well equipped. So we are well versed with the structures, and they can do well if they are fed with the requirements that need to be in the hospital. Madam Speaker, we are also happy that the government gave us doctors. We are equipped with seniors, doctors, the consultants are there, and the surgeons, and all doctors. We are equipped with the doctors and equipments in the hospital. So, Madam Speaker, we are very happy for that in Mubende. However much, Madam Speaker, we have challenges in the hospitals. The first challenge is about the medicine. Madam Speaker, you bear with me that the referral hospital is working for more than 5 districts. And on top of that, how they feed it with the medicine, it's very amazing. We have big numbers, but the medicine they give us is very little. And it takes it time to help the patients. Two, the major challenge I've faced in the hospitals that the government, Madam Speaker, you need to look in it. It's about the doctors having clinics around. It's a major a challenge. You find a doctor, a consultant, but he also has a clinic around. By the time he could be in the hospital, he's catering for somebody in his clinic. It's very, very a great challenge here in Uganda. We need to see how we can harmonize it. Madam Speaker, we face a problem of blood. We are attached to Kampala, Nakasero Blood Center, but we usually have the problem of blood. We are also appealing at if they can attach us to Fort Portal, because Fort Portal Center has blood always. Sometimes we rush to Fort Portal and helps us, but Madam Speaker, as a referral hospital here in Mubende, and you are here, you can help us to see that the government feel the problem of the blood. Allow me, Madam Speaker, once again to welcome you to Mubende Municipality, and allow me to stop there. I wish you well, Madam Speaker.
Thank you so much, Member. And I've really enjoyed my stay in Mubende. I love the good infrastructure like you earlier mentioned. We're just swinging on the roads, enjoying the infrastructure. And I was thinking, this is beautiful. Mubende is beautiful, but I hope as we discuss today, the infrastructure that is as beautiful and well-maintained is also contributing to the improvement in health service delivery. So thank you so much, Honorable Member, and I'm going to take this very opportunity to introduce the next speaker, and that is Honorable Bob, to take on to the August House, and he will give us a feel as a born and raised of Mubende. How have you seen the sector evolve over the years, and how do we stand currently? What is working for us? What is broken? And later we shall be discussing the next as we move on. Welcome to the floor of the August House, sir.
Thank you very much, Madam Speaker. Honorable members, my name is Bob Richard Chamanywa, and I am going to represent Mubende Municipality constituency. I'm extremely humbled that you've given us an opportunity to come and listen to us. Mubende Municipality has come a long way. In 1903, when the Arab traders came here and they started doing small-scale businesses, they introduced a few drug shops for them to cater for their medication. Back then, our elders were using medicines, herbals, trees, and flowers, and soil to rest themselves health-wise. Eventually, we started revolving, and in 1992, we upgraded into a trading center where we started seeing drug shops coming in, and in 1997, we developed into a town council, where we then had Mubende Hospital. We saw the evolvement of our health system coming into gradually from the herbals now to Mubende Hospital. Over 10-12 years ago, Mubende Hospital grew into a regional referral hospital, not only for Mubende municipality, but also the district and the entire Albertine region.
2016 marked that point.
2016 to be precise. And over time, we've also seen the evolvement of very many other health facilities. So currently, Mubende municipality has 6 facilities. 1 regional referral hospital, which is semi-autonomous and independent. We have 4 healthy center 2s, and then we have 1 healthy center 3. I want to be one of those people who have been in this place to appreciate the people that have been behind the construction of our health system, and they really deserve credit. However, in the situation in which we are, all the way from the history I've told you, we've also seen Mubende municipality grow in very many other places. The influx of people coming in Mubende municipality is high, and as such, there has been an effect on our health system. So we have challenges. Where we were now, we find our system sick because of the influx. And these are the issues. The number one issue that is affecting our health system is governance, the leadership of our health system. We have an uneven distribution of health facilities. Let me give you an example. In the South Division, where I come from, which has over 40,000 people, we only have one health facility, which was just recently commissioned into a health center 2. Can you imagine a health center 2 serving over 40,000 people? That's a very big problem, and it's the only one. In the West, we have 3 health center 2s. By health center 2, I mean you have a facility that has a few medicines, but you have no medical officer. My mother, my wife cannot even go and give birth in there. So they will have to trek all the way from Busali, for those of you who know Busali, to come to the hospital. You imagine a mother who wants to give birth coming all the way to the regional referral hospital. Number 2, we have a challenge of balancing the core building blocks that govern the health system. The health system is supported by funding. 10 years ago also, when the regional referral hospital was constructed, the director has been asking for funds to be increased from over 800 to 1.5 billion shillings for administrative costs. 10 years later, that money is not there. You find the funding of the system sick. The director will not do his work. Our health facilities used to get PHC funding of over 3 million shillings, which also, by the way, comes in installments. Number 3 is the issue of governance and human resource. I want to thank the Speaker for giving us the insight of us having doctors in Mubende Regional Referral Hospital. But the doctor-patient ratio in Mubende Regional Referral Hospital is alarming. That is why you find our mothers seated on the floor waiting for a doctor, because the ratio is abnormal. Some of the specialists you're talking about do not even stay in Mubende municipality, because when we were talking about the infrastructure development, we only built the construction of the ward, and we forgot to build where this technocrat is going to reside. We forgot to build where the nurse is going to reside, and that's a very big challenge that has to be managed. The issue of logistics and technology that is required in our hospitals is also a very big challenge. Whereas we have a regional referral hospital, you'll find the machines there are not working. You'll find the stethoscopes absent. You'll find the machines, the blood machines, unavailable. The system is sick. We need technology. We need supplies and sundries. The Ministry of Health has a cycle within which annually we are supposed to have medicines. Mubende municipality is still lacking the full management of that cycle, and that is affecting our system. In just 1 minute. So what do we need to do? We need to have issues of our governance managed. If we are going to build health systems, we are going to have all the core building blocks managed. If you want to build a hospital, think about building the staff welfare of the people that are going to come in. Think about having the doctor-patient ratio. Think about enhancing the nurses' welfare. Think about the people who are actually going to work in there. Think about the logistics. And importantly, think about the financing. Because if you cannot have financing, then the whole system is going to be a cake. WHO's I Wonder matters a lot on issues relating to quality, accessibility, affordability, and availability. I am looking forward to us having accessible services so that my mother in Katabalanga can be able to access services. I'm looking at accreditation of our health facilities so that we can have at least a health center 4 in every division where we have a doctor.
I wish to interject because later in the next session, Honorable Member, we shall have a way forward in our last segment. So I'll gladly call you back onto the floor to give us what you think should be the way forward. For now, thank you so much for airing out those views and giving us a point of conversation on how to drive this particular discussion.
Thank you, Madam Speaker.
You're welcome.
I'm happy I'm going to get another chance.
I'd like to take this opportunity to thank everyone watching NTV People's Parliament. We are coming to you live from Mubende District, and we are at the Mubende Municipal Council. And we're discussing matters health. For those watching from home, thank you so much for being part of NTV People's Parliament. And we are bringing Mubende closer to you in your house to understand the Regional Referral Hospital that is in the center of Mubende, which serves across, like we've had, over 8 districts in the greater Mubende region, is being faced by a number of challenges due to the huge influx. We're talking about millions of patients coming through. We are talking about drug stockouts. We are talking about blood shortage. And also we are here to understand what is working, what is broken, and what is the way forward. Thank you so much for making NTV your #1 station. And remember, your voice matters, your ideas count, and they shape this nation. For now, NTV People's Parliament takes a very short break. When we return, we shall be having other members of Parliament to give their lived experience in Mubende District as far as accessing health services is concerned. Stay tuned. Welcome back from that break. You're still watching NTV People's Parliament, and we are in Mubende District to assess the state of health service delivery in Mubende, with Mubende Regional Referral Hospital serving most of the districts across the greater Mubende region. Amidst us, we have the administration of the hospital. The reason why we had honorable members come onto the floor to give a preamble and also elaborate on the key issues here and there. But amidst us, we have the heart of the Regional Referral Hospital Administration, and at this point, I would like to take onto the opportunity to invite the senior administration from Mubende Regional Referral Hospital to give us the numbers. How does it look like? It is the month of April, from January. How do the numbers look like? We have this hospital serving across 8 districts in the greater Mubende region, and here we are looking at millions of patients coming through the hospital. I feel like even though it's a very huge hospital, there has to be pressure on it. Millions coming through. Thank you so much, Honorable Member. Mr. Nesmas, take to the floor of the August House.
Thank you very much, Honorable Speaker. The rest, Honorable Members, enjoying the August House.
Please help me and move closer and speak to the microphone directly.
I'm called Onesmus Chivaya, Senior Hospital Administrator, Mubende Regional Referral Hospital. I'm privileged to have People's Parliament in Mubende. Thank you, and I would wish this would be continuous. At least every year we should have you. For the purpose of time.
Mr. Chairman, they've invited us to come continuously. So we can stay for the entire week and then come again, not so? Please, thank you so much for inviting us continuously. We shall be in Mubende to address the concerns of the people.
Okay, thank you. Yeah, I will be brief since I've been given only 3 minutes to give this presentation. Honorable Speaker, we are privileged that Mubende Regional Referral Hospital is serving 5 districts, and these 5 districts include Mitiana, Chivoga, Kasanda, Changwanzi, and also the neighboring districts will also serve, because some neighboring districts have people who are near the referral, and they include Chegegwa, Kakumiro, even some patients come from Chivale and Sembabule. Therefore, because of that, Honorable Speaker, I heard the previous speakers mentioning that the drugs we receive from government, at times on arrival, they take short time and they're finished. It's simply because of those numbers that come from the neighboring districts. Thank you, Honorable Speaker. Next, Honorable Speaker, we are privileged with the government that at least it enhanced health workers' salary. Therefore, at least we are enjoying. However, the support staff are still also wishing to have their salary enhanced. On the services offered in the regional referral, I may not mention many, but they are not different from other services of other referrals in the country. But in general, we have general surgery, we have orthopedic services, we have ophthalmic, melogy services, we have eye, nose, and throat services. Honorable Speaker, we have also urology, we have dental services, we have theater services. We also have, under the Department of Obs and Gyn, we have family planning services, we have antenatal services, we have labor suit. In labor suit, we have normal deliveries, assisted deliveries, cesarean deliveries, and postnatal services. Honorable Speaker, of recent, we were blessed, we received a CT scan, and this is also giving several services, as you might see it when I'm giving the statistics of how many people have served from January to March this year, Honorable Speaker. Then on top of that, we have also general medicine, tuberculosis services, psychiatry services, occupational therapy services, we have laboratory services, we have radiology services, ultrasound scan services. We have also received a specialist, the pathologist, we have him also. Since of recent, government thought of empowering regional referrals. They have extended services, Honorable Speaker. They gave us a pathologist. They have also given us the senior consultant surgeons. We have them. We have been facing a challenge of people getting involved in trauma or injuries, accidents. We are having several referrals to the national referral simply because we never had orthopedic surgeon, but now we have an orthopedic surgeon, Honorable Speaker. Speaker, I would like to update the August House that Mubende Regional Referral Hospital has not stayed for long like other regional referral hospitals. Therefore, we are all consulted in the 5-year strategic plan to prioritize either to start with staff quarters for the human resource or to have more awards to extend services. Therefore, after the consultation, the majority members, Honorable Speaker, they said, let us start with wards, then we end with the staff quarters. Okay. Honorable Speaker, I'm updating you that in this year, 5-year strategic plan, we included the staff quarters, and I know it will be considered.
And I hope the 5-year strategic plan is really a 5-year strategic plan.
It is real, Honorable Speaker.
Okay.
Then, by statistics, Honorable Speaker, maybe we also have private wing. You have heard of the multi-complex block, which is supposed to be commissioned soon. Therefore, it will also give other services. However, a unique service which we didn't have in the region, especially that would help you, Honorable Speaker, at this moment if you would fall sick. We have not been having private wing, but it has also given a provision of where the corporate patients.
So sickness has levels of corporate and...
yes, at least... Like,
how did we get here? So what is the level of corporate and non-corporate? How does it work?
All along we have been giving general services, Honorable Speaker, but there are some members of parliament, you find the Honorable Speaker, you find the business tycoons. They don't wish to be admitted on the general ward, Honorable Speaker. Therefore, we have also given a provision to put their wing as private wing.
We are elevating the sicknesses.
Yes, and we have put at least 35 wards for them, self-contained and well-equipped with the drugs.
Honorable members. There's a point of inquiry, and I protect you because you're my honorable. So please, honorable member, take the floor of the August House, but I protect you. You just stand aside a bit. I'll protect your time. I give you an extra seconds, but anything. Honorable member, please take to the floor of the August House.
Thank you, Madam Speaker. I would like to inquire from the admin of the hospital. He has talked about adding on the private wing, which is about to be commissioned. But before we get into that big private wing, so far there is a wing that has been existing, and that private wing has not been having doctors, because I had a patient whereby she could not get medication within time. So how are you going to manage that new block, yet this small one had failed to get enough?
We are still having challenges of drug stock out, doctors, patient,
yes,
doctor ratio, and then we are having a new building for the elevated class.
Okay.
So, honorable member, I keep protecting you.
And yes, another thing is the current situation at the hospital, the facilities are still lacking. For example, it has got a generator which is big. I, for one, had a patient there. She was a mother who was going to deliver, but to my surprise, I took the lady to the hospital. Reaching there was no power. So the doctors that were working for that shift, I asked them that, how are you going to handle this situation whereby someone is going to deliver and there is no light? They told me that you, the person who is catering for that patient, you will have to hold a torch.
Are we still talking about the regional referral hospital?
Yes.
In the center of Mubende?
Yes. I personally had to hold a torch for that woman. So the doctor told me, you just point direct there so that I can see.
Where?
Yes. Where the head is going to come from. So I had to hold my torch of the phone, and to make matters worse, my battery got down. So I was like, how are you going to handle this? She told me that there is no way, there is no other way, because our generator uses a lot of fuel. So my urge is, you as an administrator, how are we going to do about that issue?
Honorable member, just to bring this close to home, which year was this? Which year was this? Which
That
month?
is last year, because the girl is now going to make 2 years next week.
Thank you very much, Honorable Speaker.
Yes, and,
it's good she's asking the right person.
Okay.
And all that she has given happened last year. But I would start with the last question, because she has talked of the generator. Honorable Speaker, this financial year, 2025-2026, we thought it wise, after writing several letters, because in Mubende region, the whole region, Honorable Speaker, we have been facing a challenge of power, electricity fluctuation everywhere. Therefore, we wrote to all several relevant offices, including the Office of the President, the Office of the Prime Minister, but we had a challenge. But we were advised by the line ministry, that is Ministry of Health, to install solar. We have also put solars, Honorable Speaker. Then we also have backups, solar power backup.
Does the machinery work on solar?
Yes, it does.
The machinery for the system?
Yes, please.
Okay.
It does. We have also installed the solar as a backup. We have also put backup per se, such that when power goes off, at least the sensitive departments have the backups.
So you're assuring the mothers in this building that come to deliver safely?
They are
But
safe.
that was last year.
That was last year. Then for the case of the first question, Honorable Speaker, the Honorable member asked about what, you can still remind me? The private wing. That we had a small private wing, Honorable Speaker. The truth is, we have been hampered by two catastrophes. The first one was COVID-19, Honorable Speaker.
Yes.
Therefore, we couldn't use the private wing because of that, because many NGOs came for support. Therefore, we changed it for support, agency support assistance to be extended. For example, the victims of COVID who could always come for review in that private wing. Therefore, we could not make it functional.
Okay.
Then secondly, when we were also counter-attacked by Ebola, still we had to create Ebola survivors clinic, and we had to put it in the same department, private wing. Therefore, it has not been running simply because of those two. We had to use it as a consultation department to review the patients of, or the victims of COVID-19 and victims of Ebola.
Thank you so much, Honorable Member. Mr. Onesmus, for coming through today and giving us an insight. Could you just summarize in...
Thank you very much, Honorable Speaker. Allow me read the number of services with the statistics we have served from the month of January to
Very
March.
briefly. Very briefly.
The number of patients admitted, Honorable Speaker, for those 3 months, we have served, we have admitted 7,176. Then bed occupancy rate is 93%, giving us that a patient stays on ward for only 3 days, Honorable Speaker. The delivery is 1,409 in those 3 months. The normal delivery have been 700, and the cesarean, helping mothers to deliver those who fail to have normal delivery, we have also helped 709. Then laboratory tests done, Honorable Speaker, 27,321. X-ray done 873, ultrasound scan done 706. Then number of antenatal attendances 1,357. Number of immunization done 5,782. Number of people receiving family planning 537. Number of mothers tested for HIV 16. Then giving us a percentage of 100, Honorable Speaker.
Okay.
HIV positive mothers initiated on ART 16 also. Number of babies born to HIV positive mothers 66. Thank you.
For this particular year. Let's give him a round of applause. It takes a very strong administrator to stand before you and defend why a mother is giving birth on a torch in 20 as early as 2023. So thank you so much, Honorable Member. And I'll be calling you back later on a later date. We're going to have other Honorable Members also air their views. You will learn new things about the hospital, I'm sure. But also, later on, you will extend these services closer to the people. Because you said there are new services, probably the Honorable Members don't know. And when we are here, this show is publicized to a very bigger audience than this. What does that mean for them? They will get to know that even before they seek for national referral, they can still get these services here, and they will know what services to access. Thank you so much, Honorable Member. I'd like to take this opportunity to thank everyone watching NTV People's Parliament. We are coming to you live from Mubende District, and we are at the Mubende Municipal Council. And we're discussing matters health. For those watching from home, thank you so much for being part of NTV People's Parliament. And we are bringing Mubende closer to you in your house to understand the Regional Referral Hospital that is in the center of Mubende, which serves across, like we've had, over 8 districts in the greater Mubende region, is being faced by a number of challenges due to the huge influx. We're talking about millions of patients coming through. We are talking about drug stockouts. We are talking about blood shortage. And also we are here to understand what is working, what is broken, and what is the way forward. Thank you so much for making NTV your #1 station. And remember, your voice matters, your ideas count, and they shape this nation. For now, NTV People's Parliament takes a very short break. When we return, we shall be having other members of Parliament to give their lived experience in Mubende District as far as accessing health services is concerned. Stay tuned. Welcome back from that break. You're still watching NTV People's Parliament, and we are in Mubende District to assess the state of health service delivery in Mubende, with Mubende Regional Referral Hospital serving most of the districts across the greater Mubende region. But before we go into that serious discussions, I would like to recognize different numbers of people that are here. Thank you so much for coming in large numbers. We are glad to have you. And for those watching at home, thank you for being part of this conversation. I would like to recognize the Mayor, Mr. Sichizivu Innocent. Thank you so much for coming through today. I'd like to recognize the Deputy Town Clerk, Mr. Tyrone Annette, thank you so much for coming through. The Acting DHO, Mubende Regional Referral Hospital, Madam Mary Namsoke, thank you for coming through. Also, I'd like to recognize the chairpersons, councillors, as well as the business community that is here in very, very large numbers. Thank you so much for coming through and being part of this conversation. We are talking about matters health, but matters health don't segregate either leaders, business community, or any other persons in the community. So thank you so much for representing, and we shall surely broadcast this live to the people in Mubende to have a clear feel on what ideas are being suggested here on the floor of the August House. I'd like to take this opportunity in this segment to welcome any honorable member who has a point to add to the education sector, a lived experience. You've been in Mubende over the years. Have you felt that the services, the health services, are actually serving to you as a taxpayer? Have you felt it close to home? Have you had challenges in hospitals? How many miles people have to walk from their sub-counties to come to the Regional Referral Hospital? Do we really have to walk to the Regional Referral Hospital? Can't we have health centers, 2s, 3s, and 4s being boosted in this district so that mothers, children, fathers as well as everyone else accesses better health. So in this particular segment, I'm going to pick on to the Honorable Member. Please come and take to the floor of the August House, and you shall only be given 2 minutes to express that view, and as soon as my sergeant at arms knocks the table, you just bid farewell to us, and we shall have another Honorable Member take on to the floor. Miro, can I have some help? You're going to push closer and speak to the microphone directly. Yes.
Thank you very much, Honorable Speaker, the Clerk, to Parliament, the Sergeant at Arms, and Honorable Members. I'm Hajat Hadija Nsubuga. I'm a business person along Habib Road, that's where I work, and the chairperson of Mubende Traders. My concern is one, I first thank the government for elevating our hospital to a regional referral. In fact, it is one of the achievements we have, but the services have remained at the hospital level, not at regional level. Mubende Regional Referral Hospital, serving 5 districts, there are a lot of things that have not been changed. For example, when you reach the emergency, the congestion itself will make other patients contract diseases from other patients because the place is overcrowded. The hospital was elevated, but the emergency side has remained too narrow to handle the number of patients that are rushed in. You find bed-to-bed congestion. In fact, patients are almost sharing beds. So we beg the government at least to have that facility also elevated. It needs expansion. I also thank the government that we have got smart roads, but a lot is still wanting. I'll give an example of Chirunji Road, that is up to Kangulumira stretch. It has never been worked on. How can a patient travel from just that road, which is within the municipality, safely to the hospital? It is still wanting. There are some roads that are major and are supposed to be worked on with immediate effect. That stretch has got the highest population in Mubende municipality here, and the road state is still alarming. It's a killer to our referees when they are referred to Mulago Hospital. You cannot be sure of the safety of your patient being referred from Mubende to Mulago. The road is in an alarming state, and it's not being talked about. I also would like to talk about the issue of blood. Let's not talk only about blood. Mubende Regional Referral Hospital is lacking blood, but the blood groups, I repeat, the blood groups, there are some blood groups that are not completely here. Last year, we lost the LOC3 chairperson, Chigando Hospital, that is the late Muzora Aaron. May his soul rest in peace. It was because of lack of blood. He died on arrival at Mulago Hospital. Imagine, we cannot know whether it was blood or it was the state of the road, but I think both led to his death. So I'm requesting the government to come to our rescue. I'm requesting to wind up to our rescue and work on that road, because it's also another killer. I would have raised more points, but because of time, I'll still come back.
We still
Thank
have
you very
another
much, Honorable
segment,
Speaker.
and we have the hospital administration. It will come in the next segment to address all those concerns. Let me have Honorable Member here before me. It's one thing to have someone in front of you with a hand up and then you keep looking around. So let me first look around here, and then so much to have you. Glad to have you.
My one and only name,
Yes.
I'm Gahanga Tumusime Vicente Kisanja.
Honorable Kahanga, can you please push closer to the microphone so that we can, the people of
Councillor
Mubende.
representing Kasambia Town Council to the district,
Okay.
and lead any other capacities. We are privileged to thank the government for constructing more infrastructure in health sector. Because in 19 86, when this government came into power, we had only 3 health facilities in Mubende, in entire Mubende. We had the Kasambias, the sub-dispensary, and the Maludu sub-dispensary with Mubende Hospital. But as we talk now, we have 1 health center 4 under construction. We have 17 health center 3s in the whole entire district. We have 17 health center 2s. This is a milestone, but we have also some other challenges. That even the health center 4 we are talking of is not functional. If you see the 4 counties we have, like Mubende municipality they have been talking of, lacks a health center 4, which would be a referral for minor cases that wouldn't go to direct to the regional referral hospital. If you see Wekula County has the same challenge. If you go to Wekula South, it is the same thing. So we need to appeal to the government so that it puts there, establishes these 4 health centers that are needed to make some minor referrals so that you can decongest the regional referral hospital. The other challenge we are facing is segregating into Ugandans. The plan we are establishing for some people to be in a private wing and others be in a general public, it's not good. It just demoralizes other people. We think that some Ugandans are more equal than others, which is not good, because you'll find that with the private wing, some people pay there some money. So all the health professionals, the consultants, will take most of their time. Those people who have money, who could go in other health facilities for the private and get services, but they will waste all the time serving these rich people. So government should make a clear policy, see that we are like other countries. If it needs for every family to pay an insurance fee for every year, so that people can get services, because life, health is life, is the wealth. If we don't have a good health, we shall not even prosper. Therefore, our government, those ones who are yearning to go to parliament, and those ones who are in parliament, whatever you could emphasize on is that Ugandans are treated. If we see that only those people who are in government, they are the ones who have the visas and tickets to go to be from outside the country to go and get treated, while Ugandans are suffering, who are taxpayers. That's very embarrassing to all the Ugandans. Therefore, I appeal to the government and those concerned to do everything so that we have equal health services in Uganda.
Thank you so much, Honorable Member. And the hospital administration is here, and later on, please note those concerns. I will be calling in us on a later date. We shall talk about the specialized unit and how this is going to be streamlined. The members want to know. Mrs. Mary over there. Also, we shall talk about the set of health centers, 2s and 3s. I'm hearing changing numbers. You will give us a clarity on exactly what is happening, because it seems the honorable members have different ideas. I'm going to do gender balance. When I have a woman, I'll have a man. When I have a man, I have a woman. I am coming to you, sir, honorable member. I am coming. I'm on my way there. But let me have a lady. Let me have a lady from the back. Honorable member, please come and take to the floor of the August House. I'm trying to balance the plate. Last time I ate from in front here. Now I'm trying to eat the greens. I had, so yes. Take to the floor, please, honorable member.
Thank you so much, our honorable chair, our chair today. And let me observe the protocol because of interest of time. I'm Ayebale Eunice Aisha, Woman District Councillor representing Chigando Sub-County, and I'm the chairperson, Health and Education Committee at the district.
Oh, we are having you here.
So I'm greatly humbled for having our People's Parliament in Mubende today. But I have several points and several concerns on our health facility, because we have been observing as a committee. We do visit the regional referral hospitals, and for me, I've monitored most health centers and schools, because I'm generalizing. I have 2 departments, but now we are on health matters. So I have to address these 3 concerns. One, we have a problem of power supply at the regional referral, which has caused to death of some prematures who are in incubators. So that is a concern which is at the health facility. One, we have generators, but it consumes 30 liters per hour, according to the observation when we interacted with the regional referral director. He told us that, so it is costly, they cannot afford to put in that standby generator to supply the whole facility. So this generator, when power goes off, that standby generator, it operates only at where the theater is and the emergencies only. So other departments get short of the service. Not only that, we have a problem of limited personnel. For example, this one, anesthesian, that who is in there, who can come in to help those people like the mothers who are in maternal health facilities. So they have that problem. So I call upon the government, if they can come in and help that, it will be okay, and service delivery will be catered for.
Can you
we
share
have another
lived
problem
experience as well?
Pardon?
Can you share a lived experience of a mother, something that you have witnessed? Because it's one thing to get the numbers, another thing to have it general. Can you bring it closer to home? How severe is this for mothers who are traveling from the different counties to come to General Referral
We have a
Hospital?
problem of mother. For example, for me, at least for us in Chigando, we okay. But people from Chiruma, people from Butologo, those ones are distant areas and hard-rich areas. So I beg and call upon. They have health centers, 3, true, but sometimes they make late referrals, and these late referrals for expectant mothers has led to maternal death. And also one experienced in Chigando sub-county, there are some mothers who were referred late, and in the long run they lost blood. Sincerely speaking, that is a challenging situation. For I call upon the government, but I thank there are some funders who help us by giving us ambulances. That is when I thank our Honorable Inebiona who gave us an ambulance to help those mothers. But let government come in and do the needful. Thank you so much for listening. May God bless you all for us.
Thank you very much for being part of NTV People's Parliament. For those that are here in the August House physically, I really, really appreciate your time. It's a very, very hard time, the weekend, as we all know it. But I thank you so much for being here. Thank you for representing the people of Mubende. The hospital administration, I would like to thank you for representing the hospital, the DHO's office, members present, leaders, councillors, the mayor, and everyone who has been here today physically. Thank you so much for being part of this conversation as we seek to build the health sectors in the different sub-counties where we come from. Now, we all know that as we wrap up the People's Parliament of this particular segment, I would like to let you know that we shall still be in Mubende next week to clearly understand the state of health access in this district, and we shall also delve deep into the issues of the people, what is working, what is not working, but also what is the way forward, because it's the most important thing. Your health comes first before your other work, because once without good health, you can't achieve anything. You won't be able to step out of your house to achieve your dreams and goals. Let's all prioritize our health. Let's look into some personal responsibilities concerning our health. If facilities have been put in place, let us respect them. Let us abide by the rules. We had the issue of sanitation in Mubende General Referral Hospital. It's surrounding. Yes, the hospital administration has work to do, but we also have individual work to do. Individual responsibility is very important when it comes to our health. Thank you so much for being part of NTV People's Parliament. My name is Betty Mudondo. I'm the Speaker of the August House. And remember, your voice matters, your ideas count, and you shape this nation.